I just love seeing all you people. This is so awesome. Let's see. All right. So I am going to pull up a PowerPoint, y'all, and get started on this because I want to make the most of your time. The information I have for you today could absolutely, without a doubt, be life-saving for you at a certain time of your life, or somebody that you love and you care for. And maybe you're just struggling with some health issues and you just can't find answers, and you've gone to the medical professionals and they just can't seem to tell you what is going on. I'm going to just put up my notes here. Since I have them, I want to stay totally focused today because there is so much information. The first thing, though, is I want to share with you is kind of my story a little bit. And I'm going to pull up my PowerPoint here. So many of you have struggled with weight, and I am definitely one of those people. My whole life, I have struggled with weight. At age, I think I was maybe 11 or 12. I was in fifth grade. So whatever age of that is, all I know, I was in fifth grade, getting ready the summer to go into middle school. And I weighed 122 pounds. I was 5'4". I was one of the tallest kids in my class. I was a woman in fifth grade. And so I have struggled with my weight ever since then in my mind, even though I was very healthy. But for a fifth grader going into sixth grade to weigh 122 pounds, I mean, my friends were all like 80, 90 pounds, and there I was. Boys didn't mess with me because I beat them up because I was so big and they were so little. Maybe that's where I get my boldness from. It goes way back then. But I am just here to share with you kind of my journey, just basically in the last 10 years. So at age 46, you can see on the left here, I definitely was not in my best. I had been with my now husband for several years. I was 39 when I met him, and, we were traveling and, having a good time. I was living life. And this was a moment this is actually a picture that the trainer that I hired took of me in 2011. And I mean, I'm wearing pants, so you can't even see the total that I got to look at every morning when I took a shower. So it was not my best moment. 2011, that same year, just fast forward, 11 months, here I was at age 45. I had really buckled down. The trainer I ended up firing because I hardly lost anything during that time. And he was working me out like a dog for 3 months, and I lost like 2 pounds. So I fired him and started my quest on my own journey, looking at diet and everything else. And lost a bunch of weight, and I was feeling really good. This was at a fundraiser for, I can't remember what it was for, but I was feeling great. Then fast forward several years to 2018, and Maureen probably remembers this picture. We were holding we had a huge meeting that we were at, and I saw this picture and I about died. I was age 52. I don't even know what I weighed there, but it can't be good. That picture put me over the edge. I got 3 certifications in keto. I started buckling down with keto. I started drinking my wonderful Slim drink, which many of you do know what that is all about. And didn't really exercise a lot. Hardly, I walked my dogs. And in 21 days, I went from basically looking like I did in the green shirt to looking like I did in the green swimsuit. And diet had a huge impact on that. Diet isn't always the answer. And then COVID hit and menopause hit all in March of 2020 for me. This picture was taken in August of 2020. And I was just appalled. I mean, these pants, I love these little pants that I have with the flowers on them. And I was squeezing into them and and then fast forward to April of 2021, at age 55, I had really gotten down to one of my lowest points. I think here I was about 135. And then a year later, just this past May, this was myself. We were on vacation in Florida, and I've maintained my weight, and it's basically become very easy. It's never easy, but very simple to maintain my weight. So I just want everyone to know that I have had my struggles. It hasn't come without my own sacrifices, but what I've learned along the way, some of that I'm going to share with you today. All right. So Now that you've heard my story, I want you to know that this Zoom is not to diagnose, it's not to treat, it's not to cure. I'm not your doctor. So I am here to basically educate and give you information, do with it what you want, challenge your doctors, do your own research. But this information you're going to get today is life-changing. I promise you that. All right. So let's see. One thing for me is I'm not looking for diagnoses, and I am really looking for like root cause. And you hear that a lot in the alternative medicine or alternative functional health is we don't chase symptoms. But the fact of the matter is most practitioners do. And I was very guilty of that. And to some degree, I still do chase symptoms, but I don't chase symptoms without having something that's very crucial, and that is blood. I want to know what is going on inside your body, and the best way to do that is with blood draws. So today we're really going to talk about what that looks like. All right, so one thing I want you to know is that it's not your doctor's fault if they don't tell you the information you're going to learn here today, because they're not learning it themselves. And also it really is the medical establishment. It's the schooling system that they belong to. They're only as smart as they choose to be based on what they learn and based on what they believe. So when we have pharmaceutical companies who are actually teaching our doctors, you're going to get medications, you're going to get surgery as options. That's what they do. They are more of triage. They're more of the trauma care, not so much the health care. So once you understand that, you kind of can start to figure out their place. And like somebody who's a naturopath or a chiropractor, or a holistic practitioner of some sort, definitely is going to be looking more at the body as a whole. So doctors only know what they're taught. You know, I would never go and do a liver transplant. I wasn't educated on that, but I am educated in what we're about to talk about today. So, all right, let's see. So, as I talked about with my journey is, you know, I have been on a quest for just maintaining weight, losing weight, never gaining weight. That's never been a problem for me. And for years I chased, you know, the newest fads. I've done just about every diet you can think of. If I haven't done it, I've heard about it and researched it, but I've chased, you know, the magic pills, the potions, the diets, the therapies, all of that. We all are guilty of that to some degree, especially if you've entered into a place where you've struggled with your weight or your health, right? We want to believe that the doctors can help us, so we go to the doctor. We want to believe that our bodies can just, if we give it a little time to rest, it can just heal itself. Sometimes it's just not that easy. We have to see what's going on in the body. So today I'm going to teach you some important details for understanding your labs, how these labs are giving you information that actually can impact your health, your weight, your inability maybe to lose weight or to maintain weight. And one thing about weight loss, it's not really about just about the food you eat. It's about or about how much you eat. What I want you to remember is the air we breathe, the water we drink, our sleep, our habits, our stress, all of those things are even more important than the food we eat, because it truly is a whole system of things that we need to look at. So when you're not feeling well and you can't lose weight, you can't sleep, you have headaches, you're fatigued all the time, you know, at some point, you just have to kind of take a step back and go, okay, I feel like I've tried everything. I just don't know what else to do. And coming into the alternative space, like I said, we don't want to just always focus on chasing symptoms and throwing supplements at it, because that's what a lot of practitioners do. I mean, we all do, and there is a huge need for that. But doing scans and muscle testing and taking assessments, it's not the only answer. You're going to be empowered today by knowing how to read blood labs, knowing what labs to get, and things are just going to become much more clearer with maybe the type of practitioner you want to go to maybe kind of just build on your health journey to make sure you're going to get the results that you want. And in the end, it's optimal health. We want to think good. We want to look good, feel good. We want to sleep good. We want to have good brain function. We want to not have, sweats all day and, and feel awful when we're trying to be, powerful men and women. So today we're going to look at some key labs. We're going to look at, let me go to the next slide here. We're going to look at the CBC with differential. We're going to look at a lipid panel, metabolic panel, thyroid. I'm going to touch on vitamin D and an iron panel. And that, or C-reactive protein cardiac, that is a good one if you have any kind of heart disease in your family, just to kind of give you some information on what potential risk you may have. We're going to look at what the numbers mean and really kind of help you determine what might be the priority for you to actually start with, because sometimes it's knowing the information is one thing, but then once you know it, what on earth, what do you do with that information? Okay, so the goal, my mind, is always kind of finding the root cause, why the body is presenting certain symptoms. And it's not always just one thing. It's usually multiple factors, but often, you guys, it's an infection, and infections become systemic. And what that means is it can go anywhere in the body. It can affect any part of the body at any time. And that is the biggest reasons why so many of the CBC, the blood labs that come back, your doctors look at it and they're like, everything looks fine. And you're like, oh my gosh, like I feel awful. Like, how can I be fine? But they're looking for things that are way out of range. And so many times these become normal labs, but you want normal labs. If they're not normal labs, the problem is much deeper. If they're telling you, whoa, you have a viral infection, they're going to be medicating you. If you have Epstein-Barr virus, they're going to tell you to go and maybe sleep for 3 months and take an antidepressant. That's not the answer. That's not suitable for most of us. So you want normal labs, but you want to be able to look at these normal labs and go, okay, now that they're normal, but I'm not feeling great, what are the things that are a little out of control? Because if you don't get a grip on these low grade types of infections that we'll see in your CBC, it's a revolving door and it's a build upon. And years after years after years, all of a sudden now your thyroid's a mess, your cholesterol's a mess, your blood sugar's out of whack, your hormones are completely out of whack. So we're gonna dial in on some of these really important steps for you to take. So how I address healing is going to be, I want to identify the triggers and fuel the body. That's step one. The last thing I want is somebody going into something that could really be really kind of hard on the body if they're not healthy on the sense of energy levels. Like, I want to make sure they're at some level, they've got a good amount of nutrients, either between diet and maybe a few supplements. But then we need to identify these triggers. We need to know what we're going after first. We need to know what is bogging down the immune system in the body. We need to calm that immune system, because if you're showing signs in the CBC that we're going to show here soon, your immune system is probably going to be either it's going to be jacked up, or it's going to be so tired from fighting whatever it is you've been fighting that it's just not working well. And that just opens the door for other co-infections and just feeling like total crud. Then after that, we want to start working on the detoxification phase. Now, I have a lot of people who will I'll put them on a very, I'll say safe and effective detox, just to kind of jumpstart cleaning up everything. And then we go into deeper things in like the third or fourth month of working with me, because we want to really make sure that the body is eliminating these infections and the detoxification systems are actually detoxified and working well. And then after that, you definitely want to be on a kind of a regimen. You want to figure out, what do you need to continue on to be healthy? Because a lot of people they don't know, and they don't know a lot about supplements, but they know they probably should take them. They might be taking things because, next door neighbor took it and she loved it and loved how she felt, but you're an individual, so don't go off of other people. So as we dive into this lab, I want you to know that the CBC is, if you could put a price to it, it's worth its weight in gold. This is the lab that is the absolute most beneficial to you. Let me start by saying, what is a low-grade infection? An infection is not debilitating enough to warrant a medical professional to give you medication. So if you go in and what we're going to talk about and your doctors are like, you do not have an infection. So what you need to know is what we're going to talk about today is a low grade infection, and a low grade infection is something that is not debilitating enough for a doctor to warrant medicating you. Okay. They're going to look at it and go, you're fine. Just maybe go home and rest, clean up your diet, eat light, who knows what they'll say. They might even give you some sort of antibiotic or something, but honestly, that is not the answer. That's just going to sugarcoat, and it's like putting a Band-Aid on an open wound that is never going to heal. And then you just keep ripping off the scab and ripping off the scab. We're going to teach you how to really assess and know what type of infection you have. So one thing about infections, we kind of talked about it before, they can happen in any area of the body. They can affect it systemically, or it can be isolated to an area. It doesn't matter. A lot of people want to go get, they'll go get poop test, and that's only telling you what's in the colon. That's not telling you what's in the brain or the lungs or the sinuses or the ears or, the tissue of, muscle tissue. It doesn't tell you any of that. So we want to make sure that you're understanding that it can be anywhere in the body. And when you get blood labs, you can see. So let's dive into this. So when we look at the CBC, so if you have your labs in front of you, you can look at the white blood cell count. That's the WBC. And so a good range for this is between 5 and 8. Now, that's the range. These are functional labs. So if you look on your labs from your doctor's office, they may even be wider. We are talking tight functional labs. This is how the body functions optimally. So you can follow your doctor's lab ranges, but here's the thing, they come from the laboratory, and those labs that come back, all these people who are dying of this and dying of that, who have cancer, who have diabetes, who have all of these issues, you're getting put into a bell curve. So you can go by those ranges, or you can say, listen, I'm not going to go by those ranges. I want to go by how functional doctors know how the body works at its best. And these are the ranges I'm going to talk about today. So when it comes to white blood cell count, WBC, between 5 and 8, very narrow window, but that's when your immune system is it's holding its own. It's doing its job. It's not too overly stressed. And it's not like geared up for some major infection that maybe you just encountered. Maybe you came back from vacation and picked up a parasite, or maybe you had the VIV, maybe you just had something going on, and all of a sudden your numbers are jacked up. They're like 7.88 or above. Your immune system's a little cranked up. If it's, I would say, like 5.2 or, to 5, the immune system's not working optimally. Like there's some stress, and maybe 2 weeks from now, you might be a 4.7 or a 4.2 because the immune system is maybe slowly getting weakened. It's tired. It has been fighting something maybe on and off for decades. Maybe you had mono as a kid and it's fighting it and just trying to keep you upright every day. And now you'll see the numbers start to creep down, and then you start taking care of yourself and feeling better, and that number gets back in maybe a 5.9 or a 6.2 or a little higher range. But this is going to tell you the white blood cell count helps us look to see what's going on with our immune system. As we scroll down, these next 5 are things that maybe you've never even heard your doctor say. You may not even really know how to say them. So neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So neutrophils fight bacteria. Lymphocytes fight viral. Monocytes fight specific to viral infections. It's going to be more specific to Epstein-Barr virus, which loves to attack the thyroid. It's considered, it's in the mono family. Maybe you've had mono when you were a teen or in college or later in life or as a young child, and herpes. So it's all in that herpes and mono family. Very specifically, when we see that number higher than 7, we're looking at specifically to those things, which is viral. Then we have eosinophils. This can be linked when I see it around 3, 4, maybe even 5, and somebody has a horrible diet. I'm thinking food issues. If they have a very clean diet and or it's over 6, I'm thinking parasites. Yes, we have parasites here. If you have animals, dogs, cats, whatever, goats, cows, whatever, and you let them lick your face or anything, I'm telling you, you have a higher risk for parasites. I have 2 dogs and a cat, so this is something I'm always looking at. And then there's basophils. Basophils are just another kind of more the parasite. I really shoot for anything over 1. If eosinophils are a little higher and basophils are above 1, I'm thinking parasites. Okay, so what does this mean when you look at your labs? So I want you to think about if you look at your labs and you see a number over 60, but let me go back. These numbers, neutrophils down to the basophils, should, if you look over to the right here, they should all equal 100%. So if you add up all of your numbers, no matter what they are, it should all equal 100 or 99.9. It'll never be over 100. So when we see anything over 60, we know you have a bacterial infection going on, low grade. You go to the doctor and say, oh my gosh, my neutrophils are at 63 and I have a bacterial infection. They're going to look at you like you have 3 heads and you're wacko crazy. So remember, you want doctors to think these are normal. You don't want them so far out of range that they're going to prescribe you something or diagnose you with something. It's low grade. It is not going to register at the doctor's office as something, as an infection. But I am here to tell you, this is your number 1 priority, is you have to find the trigger, and the triggers are usually found right here in your CBC in this section. So look at your white blood cell count. Is it low? Chronic, you've been dealing with something on and off for a long time, your immune system's having a hard time keeping up. Or is it above 8 or close to 8, and you're dealing with something that maybe is acutely, it's active, something is aggressively entered into your body that you're struggling with. Okay, so over 60, you've got some low-grade bacterial infection going on. Lymphocytes, they fight viruses. So anything over 30, functional medicine, 25 to 40, but I am here to tell you, when we look at viruses and we address them when they are above 30, not above, well, above 42, but when we look at our baseline being 30, people start getting their energy back. And the way we address it is super simple. Viruses are the easiest thing to go after. So if you're looking at this and you're going, oh my gosh, I'm like a 52 with my viral count, with my lymphocytes, don't worry, let me know. We can easily help you with that. But if it's above 30, that's your marker, that's your range. Anything above it, you're looking at a viral infection, and that can be anywhere. It can be in your ears, it can be in your brain, it can be in your sinuses, the lungs, it can be in your joints, it can be in your liver, it can be anywhere. It can be in your gut, it can be anywhere. When we get to monocytes, this is viral, but specific to the Epstein-Barr virus. These are things that just knock you on your butt. You are exhausted, maybe hair's falling out. A lot of times when monocytes are high, we see some thyroid issues and we see autoimmune issues. So anything above 7 to 12 is considered a low grade infection. If you go to the doctor and it's like 13 to 15 or higher with monocytes, you could probably get an Epstein-Barr viral test, which all they're going to do is pretty much tell you to go home, give you an antidepressant, tell you to go home, go to bed. And they really can't do much for you because they don't know how. There's not a medication for it. So what they'll do is send you home, but you are looking at something in that herpes and mono family. And like I said, Epstein-Barr loves the thyroid. All right, moving on. Eosinophils. Eosinophils, if they're over 3, we're looking at diet. Do you have your diet cleaned up? Are you in check? Are you avoiding just bad food? You've been on a quest for your health for a long time. You avoid gluten, you don't eat sugar, you don't eat dairy, and you're still feeling like crap. And we see your eosinophils come back at 6 to 9 or 10, somewhere in there. I've had them like up to 12. This is usually then hands down a parasite issue. And again, we have protocols for these. Do not, if you see numbers that are outrageous here, find a practitioner that you trust, that you can take this to, teach her what you've learned about your labs and see what they can do. I mean, this is what we do here, but if you're working with somebody or you don't live near us, we do virtual as well, but you definitely want to address these issues. And basophils, we seldom ever see above 1. Every once in a while, I'll see it at 2 or 3. And usually it's tied into the eosinophils. Okay, so we definitely want to look at those things. Okay, as we move on, just to repeat, we've got your white blood cells count 5 to 8, anything outside of that. But here's the thing, you could still have a low-grade infection in your neutrophil, lymphocytes, monocytes, eosinophils, and basophils. You can still have an infection going on, and your immune system, your white blood cell count can be good. So if you have like neutrophils at 68, but your white blood cell count is 6.8, listen, that's great. Your immune system is holding its own, but there's going to come a point where it may not. So you want to address that bacterial infection. And most of these infections, like especially neutrophils and eosinophils and basophils, they come with a co-infection of fungus. So in my office, we treat both at the same time, because the last thing I want you to do is, yes, we get rid of the bacterial or we get rid of the parasitic issues, but now you still have this fungal issue. We take care of it. We do it all at once. Okay. Let's talk about autoimmune. In your CBC, not only does it tell you how your immune system's holding up, and it tells you what kind of low-grade infection you might be dealing with, but it can also give you a little bit of information about autoimmune. So the N and the L are neutrophils and lymphocytes, okay? So your neutrophils and your lymphocytes should be, even if one of them is off and one of them is showing signs of an infection, it should be a 2-to-1 ratio. Okay, so let me just move. I'm going to move y'all up to my screen here so that I don't know if I'm in the way there. So if it's not a 2-to-1, so let's just say, for instance, your neutrophils are maybe 47 and your lymphocytes are 43. That's more of a 1-to-1 ratio versus 60 to 30. Okay, so a 2-to-1 would be 60 to 30. A 1-to-1 would be, say, 47 to 43. That's more of a 1-to-1. That is a sign that you're having an autoimmune flare. So if you were to go get blood labs done and you see this, note how you're feeling, or go, if you had blood work done 3 weeks ago, it's like, how are you feeling when you had the blood work done? Were you a 2-to-1 ratio with your neutrophils and lymphocytes, or a 1-to-1? Because you might have been having a flare. And autoimmune, just like so many other things, ebb and flows. And it's stress, sleep, toxins, molds, foods. I mean, so many things can be like the trigger to the trigger. So that's why you need to know, are you dealing with a bacterial or a lot of autoimmune? We're seeing high monocytes, and like it or not, we're seeing a ton. If you've had that in your arm, I am here to tell you, pay attention to monocytes. We are seeing a huge spike with people coming in who are saying, oh my gosh, because I've been teaching this for a while now, that people are seeing their monocytes, and I'm conversing with other practitioners. We're seeing a huge uptick in monocytes like we've never seen before. So you just got to know what to do about it. That's the big thing, is it's there, treat it the way you should treat it. Okay, so The other way you can do is we're going to talk about TPO. We're going to talk about cholesterol as well. And we can kind of confirm this autoimmune issue and kind of narrow it in to make sure like, okay, so this might be something I really need to pay attention to. And let's talk about iron. Okay, so iron is so important. I just have to tell you that you don't want high iron and you don't want low iron. You really want to find that kind of happy place in between, okay? So when we are looking at iron, we're going to come back to the CBC here in a few minutes because you don't always have to get an iron panel. I think if your doctor will run it, get it with the TIBC. That's your total iron binding capacity, as well as like ferritin and serum. Those are 3 really good markers that you want to have ran. I will tell you, low iron equals low oxygen in the cells. So if your cells don't have oxygen, they can't rebuild, they can't replenish, and they can't provide your body with energy. So are you tired all the time? It could very well be a iron issue. So let's just take a quick, I'm just going to spend a few moments talking about the iron panel. Iron's the transporter of oxygen to your cells. All the cells need oxygen. That's how the work gets done in the body. But the TIBC is a really good panel to run because the serum blood is going to be what's in your blood at the time of the draw, and your ferritin is what is stored showing to be stored at the time of your blood draw. But what it doesn't tell you is iron getting into the blood? So as you look at this page, what I want you to look at this little diagram in blue here, where it looks like little horseshoes, those are receptors out of the cell. So when they're empty, that it's kind of opposite with the TIBC. When your TIBC is high, it means these little receptors, these little horseshoes, they're empty. They don't have iron getting in there. And if they're full, which means then your TIBC would actually come in low because there's nothing really to fill. It's showing that everything is filling. That's a really good sign. So just if you're going to have iron done, we're going to talk about how you can confirm how you can see if you have an iron deficiency or not. But this is going to tell you, the TIBC specifically is going to tell you, is it even getting into the blood? So if you're really fatigued, maybe you've had really hardcore menstrual cycles growing up, you might even think you're iron anemic. But if you're not doing and that's usually when I run a TIBC, is when I know women have had very heavy periods. But I'm going to show you other ways without even getting this done that you can even look on that CBC to see what your iron. So that CBC, again, gold, right? I'm just going to check my notes here. Oh, so one thing that's interesting to note is those iron receptors, when they're empty, there are 2 main things that actually affect your binding iron, and that is going to be toxins and emotions. But one of the biggest thing that eats up iron is bacterial infections, very specifically the H. pylori overgrowth in the gut just loves to eat up iron. So just note, if you have gut issues, you want to clean that up. You want to be detoxing the gut, but you don't want to just detox the gut. You want to detox the detoxification system. And if we have time, I'll chat a little bit about that in a little bit. But what is one of the best ways to get iron? I will tell you, it's not from supplements. There's very few supplements on the market that actually do a good job. We do have some liquid iron. I don't sell it. We just recommend it, but there's some liquid iron that you can do, but you do not want to take iron unless you absolutely know you need it, because it can constipate you, and too much iron, now it can take up too much oxygen. So too much is just as bad as not enough. But one of the best ways to get iron is going to be through red meat, medium rare. If you don't like red meat, then you really need to test your iron, and you might want to first try doing a liquid iron supplement. And if that doesn't work, you may have to go get transfusions at the doctor's office. But supplements, there's like 2 companies that I would only recommend supplements from. But eat red meat. It's good for you. It does not spike your cholesterol. But your body is going to need iron to heal. And, we need to make sure your gut's working well too. So, and we're going to give you a couple labs to see how your gut's working as well. So it all kind of comes together at the end. Okay, so let's see, let's go to this next one here because we're going to break it down. So let's go back to the CB. Oh, I'm sorry. Let's see. I want to go back up here to the CBC. I may have a slide out of order. When you look at your slides here and you see the RBCs and you see down to the RDWs, that is where you're going to see if it's on the low end of the ranges. You'll note female and males. You're going to note if it's on the lower end, you're looking at iron deficiencies, and some may be in range, but specifically the RBCs, the hemoglobin, the HGB, and the hematocrit, the HCT, though, and even the MCV, those are mainly the ones I look at to see, is there some sort of iron deficiency going on? It will be low. Okay, so let's go back. I may have a repeat of that slide in here. Oh, there it is. I must have just missed it. So there you go. Let's talk about vitamin B. All right. So if it's low, we're going to look at if it's high. So if we're seeing that it's trending high, we're going to be looking at the B vitamins. Okay, so everyone knows about B vitamins. We've got niacin, B6, we've got B12, we've got folate. Those are one of the those are the popular ones. But what we're going to be looking at is how efficient is your body at using these B vitamins. Okay, so it's about the ability to be able to use B vitamins that are being converted from your food you eat, not necessarily the supplements you take, but it's a methylation process that has to happen in the body. So that's why methylcobalamin B12 is super important, and 5-methylfolate is super important. Don't be taking folate. Cereals that are fortified with folate, do not buy. You're getting actually, it's like eating a rock. You will not assimilate it. It is a marketing ploy that the FDA has just let go. They don't care. They let them put whatever they want on the label, but you are not going to benefit by getting good, high quality B vitamins if your food is fortified with it. I guarantee you that. Okay, so let's take a moment here to just kind of dive into the B. If these numbers between the RBC down to the RDW are on the higher end, so if the majority of them are on the higher end, you're going to be looking at a problem with that vitamin B being efficient in the body, mentholating it. Don't go out and start taking a whole bunch of B vitamins. Like, that is not the answer, because there's something going on. There are certain ingredients. I have one supplement in particular that opens up these cells to allow that methylation process. But again, you want to know you have that problem before anything, and it might not. Some people think, well, I have MTHFR. Well, yes, you may. So more important than ever that you take the right kind of supplements, but never take cheap supplements, especially if you have health problems. Work with a qualified health professional. Okay. I just want to spend a few moments before I go on with our slides. I want to talk to you guys about vitamin D before we get into the CMP. All right, so the vitamin D, I've got some notes here because I do not want to leave anything out when it comes to vitamin D. Okay, if the CBC is worth its price in gold, and when it comes to vitamin D, it seriously is worth its price in silver. It is so important. I don't care what you hear. I have been working in this field for almost 12 years now, and there is such an impact that vitamin D. And I know Maureen Henderson, when we started working together with her health, she had thyroid issues and she had her thyroid removed. She didn't have it removed. They took it. And what she found is vitamin D had a huge impact. Even after she had that done, she was still suffering with the same things. But once she got the right nutrients, really, even vitamin D really helped. All of a sudden, those things went away. So it's like, boy, before they removed my thyroid, maybe if I would have known more about vitamin D, I could have, saved myself from losing my thyroid. So let's talk about thyroids. I recommend super high levels. Like some of you would be like, no freaking way. Depending on how low you are, which we see low, I guarantee you're low. 1 out of 50 people are even close to being around 80 in range. And 80 is the range that I like to see, 80 to 100. If you're below 80, you have some issues with vitamin D. And I mean, depending on how low you are, I might start you out at 25,000 units a day for a month. And I mix it up. I do some liquid and some gel pill. So here's my thoughts on vitamin D, you guys, and what you need to know. It contributes to bone health, especially calcium absorption. So we can even see, even if you didn't get a vitamin D level, often we can see if your calcium is low, we can see vitamin D levels are low as well. It's a key supporter to the immune system. It calms the immune system, helps prevent and control autoimmune, promotes cardiovascular health, regulates blood pressure, cholesterol, and inflammation, helps manage blood sugar as it works with calcium to regulate even insulin production. Do we think we have a problem with diabetes in this country? And we have people on so many drugs that actually halt all the stuff going on in our body, like it breaks down our bone and everything like that. Prevents depression and mood disorders, helps with hormone balancing. So low levels of vitamin D interfere with proper testosterone and estrogen production. And guess what the side effects of that are? Low T and estrogen out of whack, weight gain. So you can go get all the hormonal tests you want, but if you don't have things in check with what I am discussing today, your hormone pellets or whatever the heck you're doing, it could work so much better if you had all this other stuff in check. So D is a fat soluble vitamin, which means we could store it, but generally we burn through it so fast that our bodies don't even have the ability to store it, and to even pull it out of storage sometimes is hard if it were to be stored. But it stores in that liver and the fatty tissues. And vitamin D is technically considered a hormone. Okay. What else do I got here? Oh, here's a big one. If you are on blood thinners, you really have to make sure your vitamin D does not contain vitamin K. So go look at your vitamin D. If you're on a blood thinner, you better make sure it doesn't have vitamin K in it. If it does, give it to somebody else, and you need to get on the right kind of vitamin D, because that could cause you an issue. Also, knowing the best time to take it. Vitamin D is fat soluble. The liver needs it. And the best time to take it, generally for most people, is going to be after 4 p.m., either with food, or some people even, I do a mix. I do some liquid and I do some gel pills. I take my liquid at night and I take my pills with my dinner. You want your levels to be between 80 and 100. Doesn't matter if it's summer, winter, spring, or fall. Most of you are not necessarily bare naked running around outside at the right time of day to absorb that vitamin D. So you have to supplement. Okay, the blood test you want is the 25OH. That's the blood lab you want to find out your vitamin D levels. You want them between 80 and 50. Do you know when they're below 50, your immune system doesn't create a cytokine storm? So how many people, and I know that sounds like, well, that would be good, right? Who wants a cytokine storm in their body? But a cytokine storm is responsible for fighting off your viruses. This is another example of where the medical establishment has totally failed us. You know, they're suppressing everything. They're telling us we're fine when we're not. This is very key information, especially if you're like, I've had the CVID for, 3 times now, or I just can't get better. Well, you might want to check your vitamin D levels. Here are some things that can show as presenting symptoms of vitamin D deficiency: fatigue, osteoporosis, heart disease, high blood pressure, cancer, autoimmune like type 1 diabetes, MS, and psoriasis. So other skin issues. And remember, vitamin D is really important for the liver. So they kind of go hand in hand, because when we see skin issues, my first go-to is liver. We got to talk about the liver. So with skin issues, you might be looking at things like just overall poor skin health, this kind of red, inflamed skin, dryness. You might experience things like insomnia or arthritis, joint pain. And joint pain, you also want to look at infection, diabetes, and asthma. You might have trouble concentrating, fibromyalgia, autism, and that chronic muscle or bone pain. So these are all things that are associated with vitamin D. And taking 5,000 units a day or 1,000 units a day, it is not going to cut it. You have got to max dose it, but don't mass dose and mega dose until you even know where your levels are at. Because if you mega dose and you're at 75, you don't need to make a dose like that. So know your levels. Okay, so here we go. Let's go into the CMP lab. And so we've got the CBC is worth its price in gold. We got the vitamin D worth its price in silver. And now we have the CMP, which is worth its price in bronze. Okay, so these are your three really key things. They're all key, but these are the really important where you can really get dialed in on things. All right, so for the comprehensive metabolic panel, known as a CMP, we're going to be looking at blood sugar imbalances, adrenal fatigue, and leaky gut. So most of the related health issues to the above, this is where people want to start throwing like supplements at it or medications like metformin and all kinds of stuff like that, which it is not going to take care of the issue. It's just going to kind of sugarcoat it. But what's happening inside the body is still happening inside the body. So we don't want to just throw supplements at it, and please don't buy supplements at Walmart and Target and CVS and Walgreens or even Amazon. And I believe it or not, I know somebody who knows somebody that used to, I don't know what they filled their capsules with, but created fake labels to mimic high-end supplement companies and was selling them on Amazon. This is very popular. So be very careful, because there's a lot of companies I work with that do not allow resale on places, third-party places like Amazon. So I would work with a health professional, spend the money getting good supplements, and then, you can't blame the practitioner if you're working with somebody and then you go, or you can't even blame this information if you're going off and buying cheap supplements. Like it won't serve you in the end. And then you're going to be right back where you started from. So work with somebody that you trust, work with somebody that will work with you, understands how to read labs, and then work from there, because you'll save so much money in the end. So, all right, so let's talk about the CMP. This is for I love this lab when I have people who are super, super stressed, because we can see a lot in this lab right here. So if you're concerned about your liver, or maybe leaky gut, or maybe blood sugar issues, this is your panel. It gives us a lot of information. So I'm going to look at, in this panel, I'm looking at the status of your adrenals, how well your liver is keeping up with things, and the demand that's put upon it. Because, the liver, here's the thing, guys, like my daughter has a friend whose dad just passed away. He was given 2 years to live. Within like a week, he was given 2 months to live. And then 5 days of hospice coming in, he died. They said he had liver disease. So you don't know when your liver's bad until it's bad. And then you're digging yourself out from the hole. And if you can be on top of things by doing a proper detoxing several times a year, eating well, getting your stress, you have to get your stress under control. I mean, I could do a whole hour just on the factors of like what to do with the liver. I'm going to kind of speed up here because I want to make sure we have some times for some questions. Okay. And let me go into the third thing that I look for in this lab is basically leaky gut, and how that might be playing a role with possible weight gain or inability to lose weight, and just your overall health, because we know 80% of your immune system happens in your gut. Or is in your gut. So we really want to make sure our gut is working well. And we live in a society of, standard American diet. That's what most of us, we raised our kids on, or depending on your age, you might have grown up in this. So we want to make sure when you get this lab, you want to tell them you want a fasting lab. And that doesn't mean 11 hours of fasting. It means at least 12 hours of fasting, not 11 and a half, not 10, 12. 12, 13. So always schedule kind of that morning fasting lab if you can, so you don't have to go half the day. So if you're going to go get labs, keep that in mind. And also tell them you want an A1C. This usually doesn't come with your CMP. A lot of doctors will run it because of they want to get you on metformin. That's the goal. That's a drug that they get paid well to get you on. So they want to get you on it. So they're going to run an A1C. And if you're over, 6, they're probably going to either give you a little warning, or if you've got a kind of a history, they may put you on it. And that is not the answer. We want a fasting glucose. We want a fasting glucose of 85 to 99. So when you are looking at your glucose number, we want it fasting. I like it towards that lower end. 85 to 90 is what I'm looking for. When you get up closer to 95, 99, I'm thinking, what did you eat? It's a moment in time. It's not a lab that I'm totally stuck into, because it really is, just a real recent number. It's that A1C though that we're really looking at. And I will tell you, if your A1C is in that 5.3 to 5.8 range, to me, that is kind of that warning zone. But if you're above 5.8, 5.9, 6.0, basically your doctor will say you're pre-diabetic. I am here to tell you, you should treat it as if you are, and you need to do things with your diet, your stress, all of that to back that up, because it impacts so much of your health. Okay. So let's see, key components of the CMP. Let's talk about what these ranges should be. So we're gonna talk about a couple key things. Here are the ranges of these that you want to try to fall into, but I'm gonna hone in on things specifically. So sodium, if it is around 135 or lower, or 140 and higher, you're looking at adrenal issues, like your adrenals are stressed. Same with potassium. If potassium is right on 4 or lower, or 4.5 and higher, you're looking at adrenals. So it doesn't matter if one or both of potassium or sodium, if one is off, you've got adrenal exhaustion probably happening. At what level, it doesn't matter. You want to address adrenals, because that plays a huge role with your hormones. Liver, your ALT and your AST, those are your liver enzymes. You don't need to know what they mean. You don't need to know anything. You just need to know you don't want to be above 30. Ideally 15 is where it's optimal. So, but 10 to 26, I mean, it's a moment in time. So if you just came back from vacation, it's probably not the best time to go get your labs done, because your liver enzymes would be high if you were in Mexico and drinking, pina coladas all weekend. But just, you want to keep those numbers within range, because the last thing you want is your liver overburden. And it's the gatekeeper to your detoxification system. So it also, if they are on the higher end, or if they're on the low end, like if they're 9 or 8, your liver is exhausted. It's kind of like with your immune system. If it's below the range, it's probably not working very good. All right. So those are kind of the key things. We look at total protein, and when total protein is not in range, we are looking at leaky gut. So if it's off, you've got gut issues. So a detoxification, the one we use, I know there's a couple of people here, our detox box, you can reach out to us, and we can either let you know how you can get it. I know there's some practitioners on here. Just ask them about it, because we've all kind of talked about it. So you can ask them if they invited you to this call, ask them about getting it, so you can work with them directly, because we work together on it. But this, you guys, is a great thing. We want to look at your liver, we want to look at your adrenals, and then the total protein, and even the globulin. I don't have it on here, but the globulin is also really important for total, it's one of the parts of total protein in the albumin. Those are, and I will tell you those ranges just for a little additional labs, if they do run the albumin and globulin. The albumin, you want between 4 and 5. So 4.5 and 5.0. The globulin, you want between 2.4 and 2.8. So those are your healthy ranges, and you can just go from there. All right, so let's move on. All right, let's just touch base with this lipid panel, because I have a lot of people who are on a statin. So, anybody who's on a statin? Yes, it's crazy. More than we'd like to even fess up to. But this is information you have got to pay attention to. All right, so first thing is, don't stop taking any medications based on what you're going to hear here today. You want to work with your doctor. You just want to be informed. Okay. So one of the first things is don't stop medications, get educated, and then start using maybe even Dr. Google to see what might be going on with side effects with the drugs you're on, because you won't probably believe that many of the things you might be suffering with might actually have to do with being on a medication. So again, I'm not diagnosing, I'm not treating, I'm not curing, I'm not telling you to stop your medications, strictly information, you guys. All right. So if you're on a statin or any med for that matter, the one question I would love for you guys to start empowering yourselves with is when you go to your doctor, say, hey doc, what do you need to see for me to get off of X, Y, Z? What do you need to see for me to get off of it? Is it labs? Is it symptoms? What is it? What are you looking for? And if they look at you like you have 3 heads, it might not be the right doctor for you. Okay. So you might want to just, if they're like, what do you mean? Like you'll be on this for life. You should never, unless it's thyroid med or insulin, honestly, there's really no need for you to be on it unless you're just not taking control of your life and you're trying to just sugarcoat it with a medication. So ask them, what do you need to see? And if they don't tell you, just say, well, is there a doctor that maybe can, and maybe you can refer me, because I really don't want to be on the statin for the rest of my life. I don't like how it's making me feel. And the second follow-up question would be, which one's the easiest medication for me to get off of? So if you're on multiple medications, those are the 2 questions that you should ask your doctor. All right. Because the one thing is, you guys, you don't have a statin deficiency. I promise you that. Okay. So let's see, when it comes to looking at like reasons for statins are going to be, one, you have a thyroid issue, blood sugar imbalance, or there's just an abundance of inflammation, which can be anywhere. It can be diverticulitis, it can be tendonitis, it can be dermatitis, it can be anything. I mean, we have inflammation in every area of our body, and it's when it gets out of control, it can be definitely a problem, right? Okay. So another thing is, with having issues with statins is you might not get pregnant. You might have, and looking at cholesterol, low cholesterol is really linked to so many things. And the things that I just mentioned, like thyroid, sugar imbalance, inflammation, inability to get pregnant, has a definite correlation with the cholesterol levels, and especially your hormones, because cholesterol is a precursor for hormones. So here's some ranges that I want to talk to you about with the lipid panel. So let's look at the top section here. This is pretty much like an ideal blood lab. Cholesterol 150 to 199, tris 75 to 100, HDL 55 to 100, LDL less than 99. Perfect, fine. Typically what we want to see, remember we talked about autoimmune, what we could see maybe in a lipid panel. Here's where you can see it. When you look at your cholesterol, you want it in range. So if it's in a range, and I will tell you, my cholesterol is always around 210, 220. I've never been on a medication, with the exception when I was 25, I was on a sinus medication because I had a sinus infection. That's it. That's it. And so my cholesterol is high. I feel perfectly healthy. I sleep well, all of that stuff. Why would I want to get on a statin? I might just run a little high. I mean, I've kind of always had a little higher cholesterol. However, if I went to the doctor right now, she would probably put me on a statin and say, oh my gosh, like your cholesterol is so high at 215 or 220. But ideally, if your cholesterol, let's just say, is 200, your triglycerides technically should be 100, and your HDL, the good cholesterol, should be about 50. So we want triglycerides should be half of your cholesterol number. So whatever your cholesterol is, triglycerides should show to be half, and your HDL should be half of your triglycerides. So if you see her on the left-hand side, when we're looking at like low, we're just looking at half a cholesterol, half a triglycerides. Okay. And if it is outside of that pattern, like let's say your cholesterol is 200 and your triglycerides are, 170, that just broke the pattern. So the example down below is an example of someone who would possibly have an autoimmune flare. So at 269, it is their triglycerides are not half of their cholesterol, and their HDL is higher than their triglycerides. I'm not going to touch on LDL because this is a pattern you want to look for. If your cholesterol is out of whack, you need to be looking at your blood sugar, and you need to be looking at your thyroid, and you need to be looking at infection. You have to get those things in check. Let's go here. I want to talk about cholesterol in hormone terms because a lot of people want to take hormone replacement. And I'm actually working with somebody right now. Hopefully by the end of the year, we might even be doing some bioidentical hormones, because I do think there is a place for certain people for these that I'm seeing with our patients. So I'm really spending the next few months looking at that. But cholesterol is super important. And if you're taking a statin, you're halting cholesterol production, you're slowing that down. And what you need to know is cholesterol is a precursor for pregnenolone. Pregnenolone is, we hear sometimes of the pregnenolone steal. So pregnenolone can go two different directions. One, it can turn into progesterone, which if you are super stressed and you are taking a statin and your hormones are out of whack and you're high stressed, cortisol is going to rob your progesterone. So you need to make sure you have cholesterol to have this cascade work. The other side of this cascade is the pregnenolone can also, we want it to produce, it produces both, but it can be a steal where it's going to go, if you have so much cortisol, it's going to steal your progesterone because of the cortisol. But on the other hand, if your estrogen and your testosterone are all out of whack, it can steal it over to the other side. And we start looking at things like DHEA, testosterone, and estrogen. So pregnenolone absolutely is needed. It needs cholesterol, so it can help support estrogen levels, testosterone levels, DHEA, progesterone, and help manage cortisol. But when things get out of whack, up and down, we start stealing from one area, and before you know it, your hormones are completely out of whack. So statins, yeah, if your doctor thinks you need them, I'd pay attention and do a little research and make sure, like if you're at 300, yeah, you might need a statin temporarily, but get your diet dialed in, do some detoxing of the liver so you can have everything working a little better. Okay, let's talk thyroid. All right, so we're just going to finish up here really quick with thyroid. Again, I'm not going to spend too much time on this because this alone is a full hour and we're already about 70 minutes in. TSH, you guys, TSH is not a thyroid hormone. It is a pituitary communicator. So you have the hypothalamus up here in the brain. Hypothalamus communicates to the pituitary, and the pituitary communicates to the thyroid. The pituitary communicates to the thyroid in something called thyroid stimulating hormone, TSH. So when you go to your doctor and they're like, we're going to run a thyroid panel, or we're going to run your thyroid and see how it's doing, and they come back and they have TSH on your labs, but they don't have any of these other things, you've got to question and go, wait a minute, they didn't even test my thyroid. And then based on that, they're giving you Levo or Synthroid, and they're sending you on your way. And chances are you are still fat, you are still tired, and you still feel like crap, because that's how standard of care, the gold standard of care, is testing TSH. It is not what you want. So TSH, you want those numbers between 1.8 and 3.0. High or low, I mean, you're going to feel like crap. T4 is the thyroid hormone that the thyroid produces the most of. It converts to T3 or it converts to reverse T3. And so when you have T4, let's say it's within range, your thyroid, that's showing us your thyroid is actually producing plenty of hormone if it's in range. Okay. So it's producing plenty of hormone, but it's an inactive form of thyroid hormone. It actually has to be converted, and 60% happens in the liver of that conversion to T3, or in the gut, 20% in the gut. So 80% is between the liver and the gut. So do you think you might need to do a little detoxing? Possibly. Again, reach out to us. We will help you get started on just a really simple, just a detox, not a whole big program, but just a detox with a good, healthy diet and some tips. But if you're not turning that T4, converting it into T3, you're probably going to feel like crap. And taking more T4, levothyroxine, or Synthroid is not your answer, because all they're doing is pumping inactive thyroid into your body based on a TSH lab that has nothing to do with the actual thyroid production. It has to do with the pituitary. So what's going on with the pituitary if that TSH is off? We have to address the pituitary. That's what we do here. So let's kind of wrap this up. Reverse T3 is the storage of that thyroid hormone. So if you're unable to convert T4 to T3, the active form, it will store as reverse T3. That's like the emergency. You're dying, you're in the hospital, whatever. It's the last minute, pull it out to be used. And it's usually in the life or death kind of situation. Very seldom do we ever tap into that until we get to that point. So you want to make sure your gut and your liver, because your thyroid it manages your metabolism, it manages your body temperature, just those two things alone. It has a lot to do with your brain health and how you sleep, your skin, your aging. So it's very important to make sure you understand thyroid. In the bottom of this, like I said, T3 is the active form, but free T3 is probably the most important number that we see, because free T3 is the lab that tells us, is the thyroid hormone getting to the cells? And free T3 is that number. So imagine if you came to visit me at my office, you drove here in your car. So you're bound to your car, you're bound to your car, but then to get into my office, you have to get out of your car. You have to be free of your car to get through the door to come up to my office. Think of that in terms of your thyroid hormone. T3 is bound to a protein and it's transferring all through the body. For T3 to be able to get into the cell, it needs to unbound itself from this protein. So free T3 is the number that is the core number that you need to know to be able to determine your thyroid health. Autoimmune, we talked about autoimmune with your neutrophils and lymphocytes. Is it a 1-to-1 ratio? We talked about your cholesterol. Is your triglycerides half of your cholesterol number? And is your HDL half of your triglycerides? So if that's not it, you could be having a flare. It doesn't mean you're like diagnosed with autoimmune, but you could be having a flare up of an autoimmune issue. The body's under attack and it's attacking itself somewhere. When we run TPO and thyroglobulin AB, that is specific to the thyroid for Hashimoto's and Graves' disease. So if you're out of range here, it doesn't mean you have to be depressed like there is no end. You just have to know what to do to restore your body's health so that you don't have these flare-ups, okay? Whoops, I guess we talked about that. Okay, so I think that was a lot of information. I just have some final thoughts here that I just kind of wrote because I didn't want to forget. But food is important, exercise is important, stress plays a huge role, you guys. And we are all so stressed these days, right? I mean, it's all kinds of stuff that we're dealing with, and we have to get that under control. But think about the water you're drinking. Think about the air you're breathing. I'm looking at recommendations. I do have a distiller that I use. I don't sell them, but I have a distiller now that I do most of my water in. I'm looking at air purification systems. I have one that I just haven't sent in yet. Look at the toxic exposures that you're dealing with as far as molds and chemicals. What are you putting on your body? What are you washing your hair with? What are you brushing your teeth with? You know, what pans are you cooking in? All of these things are important, but a couple other things that are equally important, and that's your mindset. Like if you keep telling yourself you're fat, you're unhealthy, you don't like the way you look old, you're telling yourself something, and that's an imprint. That's a total imprint of how your body is going to react. Your body can't heal if it knows you hate it. So learn to love the body you're in and just do some of the right things. It's really not that hard. It truly is not. And it doesn't have to cost a fortune either. I know there's programs out there that are $10,000, $15,000 a month. You don't need to do that, but you do need to take action and think about childhood experiences. You know, when I think about childhood experiences when it comes to weight. One thing that's interesting to me is I had a client once who, cheerleaders were evil. They were mean to her. They were all skinny, snotty little, whats. And she just always associated being skinny with being a brat, and she's heavy. And so it was weird once we got and we dug deep and we got into that. It was like this veil just unlifted, and she realized it wasn't the cheerleaders. It was just her mindset and her childhood experience that was kind of holding her back internally. And it was kind of like a forgiveness type thing. So just know that you can heal yourself, but you do want to take action. And hopefully today you were able to get some information beyond what maybe you've ever heard before. We are going to be doing through the month of between August and September. We're going to be doing, for anyone on this call, $400 lab review, and then kind of just a written assessment of what we feel is going on. We'll read up to 6 of your previous labs. You'll save $95 on this. This is how you can reach me if you want to take a picture of this or a snapshot on your computer. That's my email, drangelaram@gmail.com. And, we'd love to just kind of reach out and help you. We also, if you are interested in learning more about the detox that we offer, we also have a full wellness plan. If you really need the guidance, our results are phenomenal. And you can actually go on drangelaram.com and hit wellness to weight loss tab. And that will walk you through that'll give you a little more information about our 4 to 5 month program. It can be longer than that depending on your goals, but that's kind of where we start. And we'd love to just chat with you to see if a detox, just a simple detox would be good enough for you, and kind of just give you some ideas of where you can start. So, and with our detox system alone, it's only $150 or less. So it's really doable. I'm open up for any questions. I do have the CBC. You can go on YouTube. If you go to Dr. Angela Rahm and you just type in CBC, it's like a 9-minute. You can go on there and get that and watch that.
Dr. Rahm, I have a question.
Yes.
So when you talked about hormones, I'm learning a lot about that myself just from my own journey. And looking at the T3, or I guess the free T3 and the free T4, what are your first things? Because I've been through a gamut of different holistic physicians, as well as general practitioners, endocrinologists, and they all seem to have different, I would call them, opinions on where these numbers need to fall. And I've kind of been on this schedule of, I had the radioactive iodine done years ago. And so, I don't know that I can necessarily tell when it's working optimally, but I can definitely tell when I feel terrible. So is there a guideline to be able to figure out, like, should you go closer to the upper part of the scale to feel optimal? Or how do you figure that out?
Yes.
Okay. Yep. For free T3, you said?
Yep. But remember, so thyroid is highly influenced by infection, stress, cortisol, and inflammation.
Okay.
So if your numbers aren't in that good range, those are the 3 things you have to look at. We need to look at what is the infection going on.
Okay. Yeah. And I know that my inflammation levels are really high. So, I am addressing those with the detox.
Good. Yep.
But how do I guess, figure out what level of medication I need to be on?
So you want to get and that is nothing that can be determined in a call, right? So that's definitely looking at things and assessing. What I would, if you are working towards cleaning up everything and doing all that, I would just play it by ear. I will tell you one thing that I'll say, I have heard and I have talked about, because I can't diagnose or treat or cure or tell you what to do with your medications. But one thing that I will say that some people have tried and it has really helped is, well, making sure if are you on Levo or Synthroid?
I'm actually on,
Or do they have you on?
yeah, I'm on Tyrosint and HP
Oh,
thyroid. I used to
okay.
be on Armor.
Yep. Okay. I was going to say sometimes even breaking up your medications, like T4 is a slower burn. So by taking T4 in the morning, but or even like a little bit later in the morning, if you're taking like a T3 and T4 combo, or if you're doing one that has both in it, you can do, some people will break it up and take part of it right away in the morning. And then like 2:30 in the afternoon or 2 o'clock in the afternoon, they'll do like another part of, the other half or so.
Okay.
Because you're going to burn through thyroid all the time. So it's like a
Right.
24/7 thing.
Okay.
But you might also you might have a need for a supplement thing, but being on the detox and doing certain things might be enough to clean up that conversion, because it's you've got to convert the T4 to
Right.
T3. Too much T3 can kill us. So if we're not converting between the liver 60% in the gut 20%, that's a lot of conversion not happening. And so you could still feel like crap. So it is kind of amazing that even people who aren't on thyroid medication, but they know they kind of have some thyroid issues, once they start cleaning things up, the thyroid actually functions better. That's what happened to me. I'm not on any thyroid hormone or any kind of medication for it, but definitely body temperature, and like I lost weight being on it just because, I was really cleaning things up.
Okay. Thank you.
You're welcome.
Hey, Dr. Rahm, can you hear
Yes.
me?
Yes. Who is this?
Hi, this is Kim Jackman.
Hi. Hi, Kim.
How are you?
I'm
Okay, so
good.
I've had some blood work done recently, and they had me with, it just says thyroid stimulating hormone. Like, I have no idea. You have, 8 or 9 things here for us to be looking at. So I have no idea, what they're even testing for, but they had mine listed as a possible underactive thyroid. But if I don't know what all these things that you've said, are, then how do I know what numbers those are?
Right. Okay. So they only tested your thyroid stimulating hormone. So if you look at the screen here, you'll see H is the hypothalamus.
Okay.
Hypothalamus talks to the pituitary. The pituitary is what produces thyroid stimulating hormone. In other words, TSH.
Okay.
Okay. So pituitary is the actual thing that they're testing. They're
Okay.
testing to see how is your pituitary working, and your pituitary is not, it's probably not working as good as it should. So there are some things that can help the pituitary work better, but they have not tested your thyroid. Standard of care, the gold standard is TSH, and it doesn't even test the thyroid hormone.
Okay.
Welcome to America Healthcare.
I got you. Yeah, very confusing after hearing all these T's and T
Yeah,
names
free
and all that.
and free T3, the FT3.
Okay.
Free T3 is the hormone that actually can get into the cell to actually do the job. So, but there's processes. And so T4, so think of it as, if you look at this diagram here and you see the T, it produces a little bit of T3, but massively produces T4, because too much T3 can give us, like, it could give us a heart attack. It could kill us. So the body, God is an amazing, he's done an amazing job with all these, safety mechanisms in here. And this is one of them where T4 is in abundance, and it's going to get through processes. It will get converted to the T3. But if that conversion through the gut and the liver isn't good, it's going to store as reverse T3. And reverse T3 is kind of like a bank account, savings account. It's like sitting there. It's waiting for that do or die situation where it absolutely needs to go and grab it out of that area of the body to use it, to keep you alive. Where most of us aren't, we act like, our body sometimes acts like that, but we have just enough to hang in there so it doesn't ever go there. And so when we see people who have good T4, maybe even good TSH, and then we see that their T3 and free T3 is tanked, it's like, well, I don't even have to test reverse T3. I just know it's going there. And so it's not necessarily giving you more hormones. It's cleaning things up, right? Doing the things like the detox. You might notice, Kim, I know you've done the detox, doing it 2 or 3 months in a row, then maybe taking a month or two off, then doing it again, just making sure that liver and the gut is cleaned up.
Okay.
Will really help. And vitamin D, stress.
Yes, absolutely. Thank you. So we need to ask our doctors, just to like one final question, probably for everybody, for a full thyroid panel. And that's going to cover everything that you've listed here, right?
And make sure you say, and I want to know my free T3, because a lot of times I'm so surprised that a lot of the labs that we work with don't automatically, in a full thyroid panel, do not test free T3. Because here's the thing, endocrinologists don't know what to do with it.
Okay. Gotcha. Thank you so much.
Welcome. Anybody else? We'll take a few more questions. So if you're asking for blood work, Christine, and for anybody else interested, you're going to want to, you have to make sure you order a CBC with differential. If you don't get the differential part, it really doesn't tell you anything. So I don't even know why they run it. So you want to make sure you get the CBC with differential, get a full lipid panel, get a CMP, a comprehensive metabolic panel with fasting glucose and an A1C. Very important. You don't necessarily have to get the iron panel unless you feel like you have a problem, because you can still see if you have an iron problem if your CBC comes back with those low numbers for like the red blood cell count, the hematocrit and hemoglobin. And then you want to get a vitamin D, the 25OH, you want to get the a vitamin D level and a full thyroid panel, and make sure they have free T3 and the TPO enzyme and the antibodies. Those two can tell you more about your, maybe like Hashimoto's is the big one that you can see it in the TPO. So you want to make sure, first step is make sure you know what infection you're dealing with. That is the most thing. If you're not dealing with that infection, it is going to, over time, it could take you out. So get that under control, find out what you're dealing with, make sure your vitamin D levels are 80 or above. It calms the immune system. It helps so many areas of the body. Every cell needs it, because you can't even work on hormones until you get that kind of stuff under control. So infection, vitamin D, iron, what are your adrenals doing? And what is your thyroid doing? What's your blood sugar? Blood sugar has a huge impact on all of this as well. So, all right, everyone. Well, if there's no more questions, I am going to sign off. And you have a great day.
Bye-bye.
Take care, everybody.